Checklist for doffing PPE Level 4 with Gowns Clinic. Prepare to doff your PPE with your observer. They will read each step aloud. PPE doffing will only be performed in designated PPE removal area. All disposable PPE waste will be placed in a red trash. All reusable PPE will be cleaned with appropriate disinfectant. Do not touch anything with your hands even after performing hand hygiene. Before leaving designated area, a staff member will inspect PPE for visible contamination, disinfect visible contamination areas using bleach white. Next, you'll confirm trained observer presence for doffing process. Disinfect outer gloves once inside the doffing area. Sit in dirty chair. Remove shoe covers. Be careful not to touch one leg with the other. Dispose of cover in biohazard bin. Repeat for the second boot cover. Disinfect outer gloves. Hands with sanitizer. Remove and discard outer gloves slowly and carefully to avoid tearing and contaminating inner gloves. Pinch one hand and lift at wrist. Roll down your hand until the glove is in a ball in the other hand. Slide a finger down the inside of your second glove and pull it off until it is balled around the other glove. Do not snap the gloves. Inspect inner gloves for visible contamination, cuts, or tears. If no tear, disinfect inner gloves prior to removing face shield. If visible cuts or tears, use disinfectant with alcohol-based hand rub, then remove inner gloves, being careful not to contaminate your hands. Put on a new pair of gloves. Remove face shield. Tilt head slightly forward, grab strap at your temples, and pull forward to allow face shield to fall away from your face while leaning forward. Place in a designated receptacle. Disinfect gloves. Remove hair bonnet. Use one hand to lift straight off top of head, tilt forward and away from the body. Discard. Disinfect gloves. Remove gown. Release the tie, grasp the gown at the hip area, pull it down and away from the sides of your body. Once the gown is off your shoulders, pull one arm off at a time. Roll the exposed sides of the gown inward until it is in a tight ball. Dispose of it. Disinfect gloves and remove. It is very important not to touch anything with your hands at this time. Perform hand hygiene and allow to dry. Apply clean gloves. Remove surgical mask N95 respirator. Do not touch front of mask. Tilt your head forward, grab ear loops of the surgical mask and pull off. Discard. With your head tilted forward, use two hands to grab the bottom strap of the N95. Pull over your head. Next, use both hands to grab the upper strap. Pull to the sides and over your head. Keep tension on the upper strap as you pull forward. Save N95 in area for depositing once doffing is complete. Disinfect gloves. Remove and discard your gloves using same procedure as described above. Once your gloves are off, do not touch your face, any exposed skin, or any other surface. Disinfect your hands with alcohol-based hand sanitizer only. Then inspect your body for any contamination. Exit the doffing area, change scrubs.